Hello, my name is Dr. Kesse-Adu. I'm one of the haematology consultants at Guy's and St Thomas's Hospital. Thank you for watching this video. First off, I would like to say a huge thank you to everyone who's dialed in to help us make this video. This is essentially a video by Sickle patients who've taken the COVID vaccine to tell you about their experiences of the vaccine. We have 5 patients online who've had the vaccine and 1 patient who hasn't yet had the vaccine, who may have some questions for them. So we'll start off first with Emma. If you just tell us about your experience.
Okay. Hi, my name is Emma. A patient from the Sickle Cell Clinic at Guy's in St Thomas's. I hadn't. Most of what I'd heard about the vaccine before I had it was what I'd heard in the news more about the progress of the vaccination program. I also had the opportunity to dial into a call with the Guy's in St Thomas's team where the staff that had it explained their experiences with the vaccine and how it was, and more about the trials, how it was run. So yeah, that was what I'd mostly heard before. I'd heard as part of that call that the main symptom was headache. So that was the main thing I was concerned about, having the vaccine. But I didn't experience any, negative side effects besides, just arm ache, which lasted probably a few days, about 3 days afterwards. So my arm was a bit sore to lift, but other than that, it was fine. Yeah, I felt it was important to have the vaccine to, protect myself. Also, I guess in a community sense to help, how should I say, the more people that receive the vaccine, the sooner hopefully we can all get back to normal life and schools can reopen and all that sort of thing. So yeah, I felt it was important to have the vaccine.
Emma, can I just quickly ask, which vaccine you got? Do you know if it was the Pfizer one or the Oxford? You had the Pfizer vaccine. Okay, and you've had 1 dose only so far, yeah?
Yes, I've had 1 dose so far, but I did book as part of the booking process. I did book my second vaccine, so I know I'll be having that in 12 weeks in around April.
Okay, excellent. Thank you so much. Okay, Liz, can we move on to you? If you tell us a little bit about yourself, what vaccine you had, and what your experience of it was, please.
Yeah. My name is Liz Blankson-Hemans, as I said before. I have sickle cell, but I also have a few other conditions, one of which is kidney failure. I have respiratory issues sometimes and cardio issues sometimes. In my mind, therefore, having COVID is a no-go. So I decided, even before I had done all my research on the vaccine, that when the vaccine came along, I was going to have it. And the reason I felt comfortable with having it when a vaccine came along is I take the flu vaccine every year, and I also take the pneumovax every 5 years, and because I need all these things to keep me going. So I had no issues with taking COVID as a vaccine per se. What I did worry about, and which I got reassured about, was how much of the COVID protein was actually in the vaccine. And I understood it from, also I attended the virtual sessions with the doctors who explained, the doctors and staff who explained more about the vaccine and the trials, that it was okay. It was very little protein. So I didn't have any issues taking the vaccine at all. And in fact, although you can't force people to take the vaccine, I did, excuse me, in my conversations with my peers and my fellow sufferers, I did say to them that I was going to take it, and I gave them the reasons why, and tried to let them know that I thought the risk of any side effects from the vaccine was balanced by the risk of me, for me not to get COVID. I mean, that for me, the risk of getting COVID was worse than the risk of taking the vaccine. I had the Pfizer BioNTech vaccine Sunday week, and I was booked for my second jab on the 28th of March. So it's a little less than 12 weeks. I think it's about 9 weeks. So I'm quite happy about that. I had virtually no symptoms. I had it about 11:30 in the morning, and I had virtually no symptoms for the rest of the day. But by the time I was going to bed, my arm was a little bit sore. It was tender at the touch. The next day, I had a bit of a temperature. I didn't have any headaches. I took paracetamol because I didn't want the temperature to go any higher. Plus, I need my temperatures recorded for my dialysis, so I didn't want it to interfere with my normal routine. And by the third day, it was gone. So my advice to anybody taking it is just don't go looking for symptoms or all the side effects that they tell you. Just read your body and a bit see how it goes. But I took it and there was nothing to fear.
Thank you. That was excellent. Thank you very much, Liz. Thank you. Ayo, can we come to you next?
Yeah, my name is Ayo, and I'm a patient at Guy's and St. Thomas's Hospital. Yes, I took the vaccine about 2 weeks ago. So, like, I know there was a lot of concern around it, and like most people, I decided to just wait and see when the rollout started, to see how it worked, especially for the elderly, to see if they'll have any reactions and what would happen. Also, I happen to work in the NHS House of Resources and the research library, and so you get to see a lot of information on both sides and stuff like that. But like some of my colleagues, like Liz has mentioned here, um, thinking about it, I always thought about having a pre-existing condition with sickle cell. I was thinking about the risk of getting COVID versus the risk of taking the vaccine. And over time, in managing my health, I've had to consider that. And I've also learned that from working with my team at Guys in St. Thomas's Hospital. And so I called the sickle cell nurse, the CNS, spoke to her that it was offered to me at work. And I knew it was going to be rolled out in the clinic as well sooner or later. And also my GP contacted me, but the first place was at work. So I did get the first vaccine at work. And again, I looked at it in terms of managing risk and spoke to the CNS. So the CNS gave her opinion. She was not too worried. She had not heard of any negative cases, and she did say she'll cross-check with one of my doctors because I'm under the medical team, the Sickle medical team. And she came back to me with hardly any concerns. And over the years working, dealing with more serious things, I've come to trust the team at the hospital. So, and from the information I read, so I decided to take it because I had the vaccine, and I think the next day I did have a bit of a achy arm, but on the day I took the vaccine, what I did was I just took paracetamol because I used to do that when I take the flu vaccine anyway. I tend to take, because I know sometimes I've left it for a while, then I would feel a bit achy or maybe a bit feverish or anything. So I decided to take the paracetamol. I had it with me immediately after I had the vaccine. And so and I went to bed that night. I was okay. The following day, my arm was just slightly sore, which happens with a normal flu vaccine as well. And I was a little bit achy, so I had another course of paracetamol the following day, and I was okay. So I was able to take it. So yeah, so I think most of my concern was just in terms of managing risk, one versus the other.
Do you know which vaccine you had?
Yeah, the Pfizer.
Everyone's
Vaccine
had the
as well.
Pfizer one. Excellent. Thank you
Yeah.
so much. Thank you so much. And then our last speaker on the vaccine is Ansella. Ansella, you don't have to, but I should be very proud if you let everyone know how old you are as well, please.
Dare. Don't you dare. Next birthday, I was 78. Yeah, 78. Oh, thank God.
Yes, indeed.
I had the Oxford one, you call it. I had that one, and because I always wanted that one from it started. But then, if I had a choice, I would have had anyone because you all always advise me to have flu jabs, any jabs that comes along. I take anything that comes along, as long as it's going to make me better. Because after living from the age of what do we call it, 1 year old, when I can remember with sickle cell, I've taken everything, and the hospital's been very good for me for the last how many years now, Dr. Kesse? Dr. Kesse, come on, wake up. How many years?
A few.
How can we say? How can I say you? How can I say? Let me see. 1962. How many years since 62 to now?
Gosh, I think that's coming up to 60 odd years, I think. Yeah.
You
Yeah, in
born,
another
Dr.
year.
Kesse-Adu.
In another year. Yeah.
Well,
Yeah,
you
no, but
you weren't born then, were you?
yeah, I know. A lot of you weren't even, your parents weren't even born then. But yes, I've had very, very good health care. From the beginning, I've had very, very health care because then I was in St. Thomas's. Then we didn't have the clinic in Guys until a few years ago. But from the beginning, I was told to stay healthy, don't go out drinking, smoking marijuana, don't ever do. But I like my drinks. Yeah, I do like my drinks. Yeah. But honestly, I'm touch wood with the help of the hospital. All the doctors and so, and the help of my family, I have stayed very, very good. And I'm pleased. I'm pleased with myself anyway. But I'm getting older now, so every day there's a new bit coming on. I'm suffering a new 3 hips, 3 new hips, not knees yet, 3 new hips, and maybe something else. But touch wood, I'm doing well. I'm Dr. Kesse.
You're doing excellently. Ansella, so when you had the vaccine, how were you?
The vaccine, I fainted when I had it, but it was no problem. I had a bit of a headache and a bit of a sore arm because that's my bad shoulder I had it on, and it was all right. It's okay. Touch wood, it's okay. I haven't had any reverse reaction because I'm allergic to penicillin. But I haven't had any problem.
Excellent.
Thank God.
No allergy reactions to it, yeah?
No.
And did you say you fainted in the vaccine center?
Me?
Is that what you said? Or did I
No.
mishear? Oh, okay,
You heard
sorry.
me.
I thought you said you'd fainted.
No.
Sorry.
I was in and out in no time at all because
Excellent.
with the Oxford one, you don't have to stay there. You have the vaccine and you're out straight.
You're out. Yeah.
Which is very, very good,
Did you need paracetamol as well?
Well, I'm always on paracetamol on time.
Okay.
So
Okay.
right, naturally, I take an extra one. I take an extra one, but it is good. The vaccine for me, it is good.
Excellent.
Well,
thank you. Thank you
so
so
I
much.
don't know when I'll have the next one, but I'm okay at the moment.
Good. Very good. Excellent. Thank you. Anthony, did you have any questions? Have you come up with any questions while you've been waiting?
I did.
Okay, so
but
introduce
yeah,
yourself as well and tell people about your
cool.
not yet vaccine experience.
Yeah, so it's good. First of all, it's good to hear everyone's kind of experiences on the chat, and equally more reassuring. I think for me, when I thought about when I think about the context of my health and the journey that I've gone on, managing sickle cell disease, COVID-19 has always been something I've always seen as a threat to my current circumstances in terms of just being able to progress and get on with life. And thinking about the impact and how we've seen people been affected by catching it. I think for me the vaccine was never really a choice. It's always been something that I've always wanted to do, because it was something that was going to protect me and allow me to just be able to live my life day to day, and I don't want anything to exacerbate my current health care. So like I said, it's always been a choice of either die from well, not die, but practically, when I consider my health and when I think about the experiences I've had and the chest infections I've had, you know, there is no hope in my mind that I would survive COVID-19. So it was either for me die from COVID or have a sore arm from a vaccine. Hence why that has always kind of been the thought process of wanting to get this vaccination. But it is kind of interesting hearing everyone's experiences. I guess what I wanted to ask was, what are the possible side effects for people with sickle cell disease? And also, why is it beneficial for people to have the vaccine, even though I am convinced, but just for others that may not be, and many of my friends are.
I think that's for me, isn't it? So we have done a video which actually shows the data of COVID and sickle. And a fair few people get admitted, a fair few people need transfusions, a fair few people needed escalation of health into ITU. But we also have a good amount of people who've managed their COVID at home and not needed medical support at all. So it is definitely higher risk in sickle patients, the infection itself, than the non-sickle population. But it is, people have got over COVID and carried on. The advantage of the vaccine is exactly what everyone said, that there is no vaccine that's 100% protective, none. So every vaccine we take, there is still small risk of infection. But the point is, vaccines reduce your risk of infection significantly. With this vaccine, the added advantage seems to be, even if you catch COVID once you've had the vaccine, it seems to express itself quite mildly. Whereas if you catch it without the vaccine, you don't know which way it's going to go. It might be mild, but also you might end up needing help from us, which nobody really wants, really. That the reason we need to do this, which is so unusual, if you think sickle patients probably have more vaccines, as Ansella said, than pretty much any other patient group out there, is because the misinformation has unfortunately targeted Black and brown people quite specifically, really quite specifically, and sickle patients fall into that group, which means that it's a bit of a double whammy. First of all, if you have sickle, you're extremely vulnerable to this infection. And then if you're sickle, you're also being targeted quite strongly by a lot of misinformation. So I think one of the most reassuring things that most sickle patients who are debating the vaccine or not could ever see is a sickle patient who's had the vaccine and is going about their day-to-day business without issue. It is worth mentioning, there was one other person I was hoping would join us on this call, but I think he's at the dentist, Patrick, who he also had the Oxford vaccine and he had it over the weekend. He's actually done a video which he'll put on YouTube, and he felt quite achy and had a fever for the day after. So he was in bed for a day after. And he's on transfusion. So he did wonder, if he wasn't on transfusions, whether it may have triggered a crisis. Difficult to say, but I can say with confidence we haven't had anyone admitted with a crisis after the vaccine. We've not seen that, and we've had patients on the program for a while now. Who knows? It may happen before it's over, but we certainly haven't seen it. Everyone who's had it reports pretty much what you did. I needed to take paracetamol, I needed to take ibuprofen, I needed to rest the day after, or I just had a sore arm. That's what it's been, versus the unknown that is COVID. So I think the argument is made, really. Did anyone else have anything they wanted to add before we wave goodbye to our audience?
I had a question. Well, not a question, just a comment to add. I have found the misinformation extremely frustrating and annoying, really, really annoying. And I've just, every time I've seen something really outrageous, wondered what could be done to control this, because this is so far out and total lying, total lies. it really makes my blood boil. And I know that some of them can be quite convincing, some of these stories, but some of them are so outrageous, but people still believe them, and keep forwarding it and making it go further. And I don't know. I don't know what can be done about it, but I just know that it's highly frustrating. People you wouldn't expect to be anti-vaxxers are convinced by these things, and it just, I'm staggered.
Yes. Yes, beyond doing this, just going out and saying repeatedly, "I have sickle, I have had it, and I haven't grown a third eye or fourth arm." I'm not sure there's much more we can do other than just keep reiterating, what is our reality. So I think initially when this all started, and patients would ask me, "Have you had it?" and I was able to say initially, "Yes, I'm on the trial. I may have had it," and then when I got unblinded, I could say, "Yes, I have had it." And it was quite reassuring for a lot of my patients to see me walking about, not. I hadn't suddenly hadn't changed. I think it was reassuring. So this will be immensely reassuring. I think immensely.
So no microchips then?
Your phone has more of a microchip than them. There's always the amusing thing is whenever people are asking about microchips, they're doing it from a mobile device, and you're like, you've got a microchip in your hand. Anyway.
That's the other thing I do add when I'm trying to tell people, get a grip, is, well, if the conspiracy is to kill us all by giving us this vaccine, who wants to be left alive on their own anyway? I'm going with the crowd. I don't want to be left on earth by myself. So,
That's an excellent note. Ansella, do you want to finish us off? Anything to say?
That's one thing I would like to say. I promised Dr. Howard that I've got 3 years to go to make it 80. Yes. Okay. And when I do make it 80, they're going to make me a big party because I'm the oldest one at the moment. Yes. So I want to live.
Of our SS patients, yes.
So, yes, of course, I'm concerned. I'm frightened about it. I'm frightened about it because you don't have to be outside to get it. It all depends. But we have got to believe in ourselves and take care. And that is the most important thing. It's, if you're going to get it, you're going to get it. And just take care of you all, say, please. And I'm hoping to take care of myself with the help of that lady in the corner there. You see that lady in the corner there? What's her name?
Excellent. Thank you so much. Thank you. Thank you all. Thank you all very, very much. This was excellent. Thank you. Much appreciated.
Thank you so much, everyone, for being part of this. Really helpful.
Thank you.
Thank you very much.
Thank
you for giving us the opportunity.
And I hope everyone takes care.
Bye.
Take care.
Bye. Take care, everyone. Bye.